picture?
There.
Okay.
It's a video. So I went ahead and washed my hands.
Okay.
And then, so can you just tell me your name?
Victoria.
Victoria, good. And you mentioned that you're Caucasian.
Yes.
And can you verify your date of birth?
2976.
Okay. And then I'm just gonna take a seat. We'll just talk for a few minutes. And you mentioned that you were here for. What brings you to the clinic today?
Feeling exhausted.
Feeling exhausted.
One of my symptoms. Over the last couple months,
Uh-huh.
I've just been feeling tired, and over the last couple weeks, it's gotten really bad. To the point where I'm watching TV and I'm falling asleep. I'm on the computer, I'm falling asleep. Just times that I'm normally fine, I'm falling asleep.
Okay.
I usually get 7 to 8 hours a night sleep, so I'm doing good with that. But when I wake up in the morning, I'm just not feeling rested. I'm still feeling tired. I'm also usually very regular, and now lately I'm having a bowel movement every other day. Where before I was going every day.
Oh, okay. So now it's every other day.
Correct.
So let's see. So let's focus.
So that's changed also.
Okay. So let's focus on the fatigue, and then we'll tackle the bowel movements. So you said you've been feeling tired.
Yes.
When did that start?
About a couple months ago.
Okay.
But it's been getting really bad the last couple weeks.
Okay. Would you say 2 to 3 months or 6 months and longer?
No, about 2 to 3 months.
2 to 3 months. Okay, good. And let's see. When you get tired, is it constant or is it intermittent throughout the day?
I guess it would be on and off throughout the day.
On and off throughout the
But
day.
I just feel exhausted all the time.
Exhausted all the time. Okay. Okay. Is there anything you do that makes you feel more exhausted than normal? Or
No. I usually work out every day. I take a spin class, but lately I've been so tired I'm only going twice a week. So it's really interfering with my everyday life.
Oh, I'm sorry to hear that. That must be difficult. But hopefully we get you started on something, or we'll figure something out that what's been going on.
Yes.
And we can help you with that. Is there anything you do that makes it better?
No. The bowel movements, I've talked to a few friends and they've recommended drinking more water. So now I'm drinking like up to a gallon of water a day, but that doesn't seem to be helping.
Okay.
I'm just going to the bathroom more often.
More often. Okay. Is there anything you do that you take or you do to help with the fatigue?
Not really. I try to make sure I get 8 hours of sleep a night. Trying to eat right. Not really. I mean, I haven't taken anything for it. No.
Okay. And then so let's go on to the bowel movements. You say it's been irregular every other day.
Yes.
With your bowel movements, what color is it?
Same color as usual, just a brown.
Brown.
But they are like harder than usual.
Harder than usual. Okay. And then is it soft or
firm? I would say. Yeah.
Okay. And then would you say you've been feeling a little bit more constipated than normal?
I would probably. Yeah.
Do you take anything?
I don't. Just the drinking of the water.
Okay.
I've been trying to eat more fiber, but that doesn't seem to be helping.
Good. Okay. But not helping.
No. And then I've also noticed too that when I'm out on a hot sunny day.
Yeah, it's going.
Okay. On a hot sunny day, 70, 75 out, I'm feeling cold and I need a sweater.
Cold. Okay.
I've noticed that recently too.
When did that start?
Around the same time. I'd say a month to 2 months.
1 to 2 months ago. Okay. And then it's throughout the day?
Yes. This is all very new. Just the last couple weeks, it's just gotten really bad.
Really worse.
So exhausted all the time.
Okay. With feeling cold, is there anything you do that makes it worse?
No,
or better?
So.
No, besides just wearing a sweater.
Mm-hmm.
Okay. Any other symptoms that I should be aware about?
None that I can think of.
Okay.
Maybe like my hair is drier than usual.
Drier hair. When did you start noticing that?
A couple months.
Okay. Okay. So I just want to see, when was the last time you saw a doctor?
Well, the last time I was here.
Last time? Okay. Oh, which was about 2 months ago.
Correct. Yeah.
Yeah, and I looked into your records, and you did labs at that time, which was normal. That's good. And I saw that everything you did, the mammogram, the well woman exam, those were normal, as well as your colonoscopy, eyes, and dental, which was normal. For your eyes, for your eyes and dentals, you're gonna be due this December.
Okay.
For another follow up on that. And then let's see here. Any chronic illnesses?
No.
No. Okay. And any mental health disorders?
No.
Depression, anxiety?
Well, I've had depression in the past, but it was just when I was going through a divorce. But you know, I wasn't seen for it. It was just.
How are you coping now?
Oh, fine.
Better.
Like, life is great now.
That's good to hear.
Other than feeling exhausted.
Exhausted all the time. Yeah. And then I know no allergies.
No.
Correct. And then I noted that your medications, you're taking the hydrochlorothiazide, and then 25 milligrams every day for hypertension.
Yes.
And then ibuprofen.
Yes.
You take it on as needed.
Yeah. My back hurts.
For your back pain. Okay. Does your back hurt a lot?
Not a lot.
Not too. Okay.
Once a month, maybe.
Okay. Any back pain today?
No.
No. Okay. And then let's see. Any other medications that you're taking?
No.
No. Okay. And then surgery. I noted that you had an appendectomy when you were 21 years old. And any hospitalizations since then? Okay. And your immunizations, how is that up to date?
Yes.
Okay, up to date. Good. And for when is your last menstruation?
Last month.
Last month.
Mm-hmm.
Okay. Has
That's
that
normal.
been normal?
Yeah.
It's been pretty regular for
Correct.
you?
Yes.
Okay, good. And then I'm just gonna ask your sexual history. Are you sexually active?
Not right now.
Not right now. Okay. Okay. And then let's go over your family history.
Okay.
So we'll start with your mom.
Okay.
Do you know any health problems with your mom?
My mom has hypothyroidism.
Hypothyroidism. Okay. Anything else?
No.
Okay. What about your grandma from your mom's side?
I believe my mom was adopted.
Oh, okay.
Yeah.
And what about you? Your dad?
He has diabetes.
Diabetes. Okay.
And I believe it's diabetes too, and high cholesterol.
High cholesterol. Okay. Anything else that you know of?
No.
What about your grandparents on that side?
High cholesterol, I believe.
High cholesterol. For both the mom and the dad? Okay. Do you have any siblings?
Yes.
Okay.
My sister also has hypothyroidism.
Hypothyroidism, okay.
And my brother's an alcoholic.
How is he doing now?
Good, better.
Okay, that's good to hear. Is this your sister older or younger?
Older.
Older. And what about your brother?
Younger.
Younger. Okay. Do you have any children?
2 children.
2 children. Do they have any health problems?
No.
That's good to hear.
Mm-hmm.
How many kids do you
2.
have? Okay.
Mm-hmm.
Let's see. So I'm gonna just obtain some of your previous history, social history. Where were you born?
Here.
San Diego. Oh, good.
Mm-hmm.
And you said that you were divorced.
Yes.
And where are you working now?
I'm a real estate agent within the city.
Okay. How's your living situation?
Oh, it's great. Yeah,
good?
we have lots of family around.
Good. Good support system.
Mm-hmm.
Mm-hmm.
And business is great right now, so things are going really well.
Oh, that's good to hear. What about your diet? Let's talk about your diet.
My diet's pretty good.
Mm-hmm.
You know, I try to eat enough red meat during the week. I try to incorporate veggies.
Mm-hmm.
I probably only eat out maybe once to 2 times a week.
2 times a week.
Mm-hmm. Fast food. Other than that, I mean, I think it's pretty good.
Okay. And then I know for hydration, you mentioned that you drink at least 1 gallon of water throughout the day.
Yes.
How do you feel about your diet?
I feel good. Now that I'm thinking about it, I've actually gained a couple pounds in the last couple months.
Mm-hmm.
But my diet hasn't changed. So I've been eating the same amount I've always ate. I mean, I haven't been eating more than usual, but I have gained a
few. Okay. So we'll address that. we'll definitely address that, maybe see what could be causing the weight gain for you. Do you exercise?
I do. I go to a spin class daily, but I just haven't been getting there lately.
Okay. I know you mentioned that. Any other exercises or activities?
No, other than my daily job.
Oh, okay.
And running around everywhere.
And do you drink caffeine?
I do. 1 cup a day.
1 cup a day.
Crazy.
Okay. Do you use any tobacco or
no?
None those vapes that you see?
No.
No. Okay. And what about alcohol?
I do drink socially when I'm out with friends. So maybe 1 glass or 2 glasses a month, maybe.
Okay.
I just drink, when I'm out with friends.
What kind do you drink? What kind of alcohol?
Red wine.
Red wine. Okay. And any illegal illicit drugs?
No. I mean, I've done marijuana to help relax me with my back pain. But it's not, maybe 2 or 3 times a year.
2 or 3 times a year? Okay.
Yeah. It's not really.
Okay. What about emotionally? How are you doing? Any mood? How's your...
No, I think my mood's great, other than being tired. But no, I think I'm feeling upbeat and happy. I don't feel sad or,
Good. With your sleep, I know you mentioned that you try to get 7 to 8 hours of sleep. Is that normally interrupted?
No,
or
it's like a full block,
Good.
7 to 8 hours. But when I'm waking up in the morning, I just feel so tired.
Okay. Any increased stress recently?
No, none that I can think of.
Okay. Any hobbies or leisure activities that you like to do?
I like to watch movies.
Movies.
I read books.
Okay, good. And particularly in your day-to-day life, do you feel pretty safe?
I do.
Okay, good. Okay, so I'm going to ask you a series of questions. I know we mentioned a few things, so I'll just clarify them. So overall health, besides your complaints of feeling tired, the constipation, and the weight gain, how's everything else with you?
Everything's good. I can't think of anything else that's bugging me.
Any changes in vision, blurry vision?
No.
Okay, good. Any ear pain, ear discharge, nose discharge?
No.
Any problems with the teeth or the mouth?
No.
No. Okay. Any chest pain or abdominal
chest
pain? Okay, good. Any difficulty breathing?
No.
Coughing? Have you been
No
coughing?
coughing.
No. Okay. And then for you're urinating. Are you urinating?
Yes, a lot.
A lot
because I'm drinking so much water.
Yeah, but is it painful when you urinate?
Painful.
No
pain. No
okay.
pain. No. And it's a good color.
Good color. Okay. And any joint any?
No.
Okay. No. With your skin, I know you mentioned you have some dryness in the skin, and then your hair is a little bit more dry than normal.
Yes.
Have you noticed any rashes?
No rashes.
No.
No.
Okay. Have you been feeling dizzy or any weakness lately?
No dizzy.
No. Okay. And let's see. You mentioned that you've been feeling a little bit more cold lately. And then you did mention the weight gain. Have you been bruising? Have you noticed a lot more bruises than normal?
No bruising.
Okay, and then no allergies as well.
No allergies.
Okay, so I also reviewed your vital signs. So it was your blood pressure is a little higher than normal. It's 140/82. But you are taking the hydrochlorothiazide.
Yes.
And then I noticed that your BMI is also 28.3, which is a little bit higher than what is expected for your age. So we'll definitely address that, and we'll discuss a plan for it later on. So I'm going to be doing a few tests on you. So we'll first start off with checking your eyes.
Yes.
Okay. So I'm going to check your... Oh, you okay? Yeah. So I'm going to go ahead and check your visual acuity. So you're going to close your left eye, cover your left eye for me. And I'm going to stand 6 feet away from you. Can you read the lowest line that you can?
LTFPH.
Good. And then cover your right eye. And then read the lowest line you can backwards.
Backwards?
Mm-hmm.
HPFTL.
Good. And then now open both eyes and then read read the lowest line that you can.
LTFPH.
Okay, good. Okay, so now I'm gonna let's do that one later. I'm gonna do a confrontation test. It's basically checking for your peripheral vision as well. So you're gonna cover your left eye. Okay. So you're gonna cover your left eye and you're gonna look straight ahead at me and then I'm gonna put up a number and you tell me what number you see, okay?
1, 2, 3, 4.
Good. And then cover the other eye and then same thing.
1, 3, 2, 4.
Good. And then you're gonna open both eyes and then you're gonna look
at
straight
you.
ahead at me.
2, 3, 4, 5.
Okay, good. So same thing, you're gonna cover your left eye and I'm gonna check for your peripheral vision.
Okay.
So you're gonna tell me when you see my hand and you're gonna say stop.
Okay.
Okay?
I see it.
Okay, good. Okay, other side.
Oh.
Yeah. Ready?
I see it.
Okay, good. And then from underneath.
I see it.
Good. From this
I see it.
Okay.
I see it.
Good. And then let's do that on the other eye. Sorry, yeah. Okay, from
I see it.
good.
I see it.
Yeah. Okay, and then on both eyes.
I see it.
Good.
I see it.
Good. Okay. So both eyes look normal and healthy, so that's good. I'm gonna just go ahead and inspect your skin, hair, and nails.
Okay.
So let me just put a hand sanitizer on. But you haven't noticed any yellowing of the skin or anything like that?
Yellowing of the skin, no.
No. Okay. So right now, for the video purposes, I'm gonna be just explaining things.
Yeah, it's fine.
Okay. And then is it okay that if for consent,
Yes.
the instructor will be viewing the video?
Yes.
Of course.
Yes.
Okay. Okay. So you're gonna so I'm inspecting for your face. I'm inspecting symmetry. I'm inspecting for any involuntary movements. I'm inspecting your hair. Have you been having any hair loss?
No hair loss.
No, just dry and brittle
Yes.
hair loss, but even distribution.
Yes.
I'm gonna be also inspecting the skull for the shape and any trauma, any hematomas or depression. So I'm gonna go ahead and touch and just assess any pain or any discomfort.
No.
At any time of the exam, if I cause any pain or discomfort, just let me know.
Okay.
Okay, and then I'm also gonna just palpate along your forehead and your maxillary sinuses, so your frontal and good. Any pain or discomfort? Good. And then I'm gonna palpate for your temporal arteries, and then down to your temporal mandibular jaw, and then go ahead and open and close your mouth for me. Good. Any pain or discomfort, tenderness? No. Okay, good. So after that, so I don't see any changes for your skin. It looks normal and healthy. No, I didn't notice any change. Sure.
I think you can take a picture if you want.
Oh, okay. Can I do it after?
Yeah.
Okay.
No problem.
Okay. Okay. And then I'm also gonna be checking for your sensory function, your cranial nerves. So I'm gonna assess your cranial nerves number 5 and 7. So this is your facial, your trigeminal nerve and facial nerve. So I'm gonna I'm either gonna touch you with the soft end of the Q-tip or the dull end of the Q-tip, and then you let me know if it's sharp or dull. So I'm just gonna let you feel it. So this is the soft, and then this is the dull. Okay. So I'm gonna have you close your eyes, and I'm gonna touch along the forehead, cheek, and jaw.
And soft.
Good.
Hard.
Good.
Soft.
Good.
Soft.
Good. And last one.
Hard.
Okay, good. And then you can open your eyes. Can you smile for me? Good. And can you frown? Wrinkle your forehead.
I can do that one really well.
And puff your cheek. Good. So cranial nerves 5 and 7 is intact, so that's good. So I'm also gonna assess for your eyelids and sclera. So I'm gonna be, so for the eyelids, I'm gonna be pulling up onto the eyelids and then pulling down to the eyelids, checking your sclera, making sure it's white, checking your conjunctiva, lacrimal system, the iris and the cornea, but it looks normal and healthy, clear and white, no discharge, your conjunctiva is moist, no redness. And then I'm gonna check your eyes real quick. So I'm gonna shine a light onto it. You're gonna look straight ahead for me. So I'm checking for constriction to your light. So I'm gonna start with off your left eye. Good. The other side. Good. And then while looking straight ahead, I'm gonna shine the light to your left eye, and I'm checking for any constriction on the right eye. So it should be constricting as well. Okay. Good. Good. Okay. And then I'm also gonna be checking for your red reflex, as well as the optic disc and the vessels. So look straight ahead, and I'm gonna check for, let's see, red reflex. So the optic disc should be sharp with no hemorrhage, no AV nicking. Okay. So let me do. So your eyes is good. Any problems with the nose, with breathing?
No.
No? Okay. Let me get an alcohol wipe. Okay. So I'm gonna go ahead and can you occlude one nostril for me and breathe in and out? Any problems?
No.
No. And then the other nostril, in and out?
No.
No. Okay, good. So I'm gonna have you close your eyes, and I'm gonna have you smell something. So you can close your left nostril. So check it for yeah. So you're gonna smell something on your right nostril.
Oh yeah.
You smell it. What is it?
An alcohol.
Yeah. And then the other side.
Oh yeah. Oh yeah. I smell it.
Okay, good. And then I'm just. So I'll also check, I'll also be checking inside your nose, checking for any nodules inside your nose.
Okay.
But I'll skip that exam. And then let me do. Any problems with the hearing recently?
No hearing problems.
Okay, good. Okay, so I'm gonna do a quick test on your ears. Oh, that's fine. So cover your one ear, occlude one side, and I'm gonna whisper from behind you, and you guess what I say. Okay?
Yes. Apple.
Okay, good. And then the other side, and you guess what I say?
Baseball.
Okay, good. And then I'm gonna do a quick Weber test and a Rhine test on you. So you're gonna tell me if you hear it on both ears or just one ear, okay? And I'm gonna place this on your forehead.
I don't hear it.
You didn't hear anything. Try again.
I don't
No,
hear
okay.
it.
So normally, normal Weber's test would be you hear both ringing onto both your ears.
Okay.
This is a.
I mean, I heard something, but I felt it like it was from your wrist, not from up here.
Oh, not from a yeah. It's like a vibration or feeling,
okay.
yeah. And then we'll also do a Rhine test, which you put right behind the ear, and then you check their hearing.
Okay.
So the air conduction should be greater than the bone conduction. And then any problems with the ear, any ear discharge? No, good. Okay. So real quick, let me just check your mouth. Okay. So you can go ahead and open and say ah. Good. You have them.
Yeah, I do.
I was like, what's that green
You have an abscess.
Okay, and then swallow for me. Don't swallow your gum. Okay, good. And then with your tongue, you go ahead and push it against the side, of your cheek, and then on the other side, good. So cranial nerves 9, 10, and 12 are intact. I'm gonna be assessing your neck. So right now I noticed that it is symmetrical, no enlargements. I haven't seen any enlargements. And then I'm gonna assess your nodules or your lymph nodes. So I'm gonna start right by the ear, which is a preauricular behind post-auricular, and then down to the occipital and posterior cervical. You okay?
Yeah.
Any pain, tenderness? No. And then I'm also going to be assessing anterior cervical to the supraclavicular and infraclavicular. I'm going to be checking your throat or your throat placement. So any tenderness, any pain? No. Okay, good. Okay, so I'm going to put my hands right against your shoulders and you shrug up for good. And I'm going to place my hands against your chin. You're going to go against resistance, good. And the other side, good. And then I'm going to go right behind you. I'm just going to assess your thyroid.
Okay.
So I'm going to be placing my fingers right along by the isthmus of the thyroid, by the cricoid cartilage. And I already inspected that she swallowed in front of me. And
Yeah.
go ahead and swallow again. Good. Any pain with that?
No pain.
No pain. Okay. Okay. It feels slightly enlarged, but not tender. Okay, good. Okay, so let me, is it
yeah.
Oh, I don't know if you have something underneath, but I'll just, okay, I'm just assessing for your skin, for any rashes or lesions. Okay, good. I'm assessing your breathing as well. And then I'm going to touch right on your chest. Is there any tenderness there? No, no tenderness. Okay. And then let me listen to your lungs real quick. Let me palpate first and assess for any difficulty breathing that you may have. So I'm gonna start from I'm gonna place my hands right along the, in between your ribs is the intercostal space. So I'm gonna go ahead and just palpate for that. And you'll let me know if there's any pain or tenderness.
No pain.
Okay, good. So I'll do that for front and back. And then I'm also gonna be assessing for tactile frenitus. So go ahead and say 99 for me.
99.
Okay.
99.
Good.
99.
Good.
99.
Okay. You okay?
Yeah.
Okay. And then I'm gonna percuss. So it should be the dull should be on the left side because of the heart. And then let me go ahead and listen to both your lungs. Okay, take a deep breath. Good. Good. This side. Good. Other side. With activity, you don't have any, when you do any activities, you don't have any shortness of breath or exertion?
No.
Very good. And then I'll do the same thing to your back. Little back massage.
I know, I was like, that actually feels good.
And then say 99.
99.
Good.
99. 99. 99.
Okay. And then let me just check for expansion. So I'm going to place my arms right below on your rib cage. Okay? Take a deep breath. Okay, release. Good. And then the other side. Take a deep breath. Good. Okay. While doing that, I'm going to go ahead and check your lung sounds in the back. Take a deep breath. Good. Okay, and to the sides. And say, whisper 1, 2, 3 for me. 1, 2, 3. Good. One more time. So that one, I'm checking for consolidation or for any fluids as well in the lungs. Making sure I inspect for any haze or thrills. Any heart problems?
No
palpitations? No.
No.
Okay. So if you did have, I'm going to be assessing for your carotid arteries.
Okay.
Assessing for heart sounds as well. But let me just make sure that your heart's doing good. Any heart problems?
No.
For you?
No.
Okay. Good. So I'll be assessing for the apical, the pulmonic, the Erb's point or tricuspid and bicuspid, checking the diaphragm and the bell as well. And then, let's see, let me assess your abdomen.
Okay.
You can go ahead and lie down, yeah. Oh, you okay?
No, that's good. I'm good.
Okay, so I'm gonna just lift up your shirt a little bit. Is that okay?
Yeah,
just
it's
a
fine.
little bit.
Okay.
Because I know it's a video.
Okay, it's fine.
Okay, so I'm gonna inspect the color, any the pulsations, anything like that, and then I'm also gonna listen to it.
Okay.
I'll just go on this side so the video kind of blocks it. Okay. Listen. So because you've been feeling constipated, normally that would be like indication of hypoactive bowel sounds.
Okay.
And then I'm gonna go ahead and palpate. So I'm
Okay.
gonna touch your abdomen and let me know if you feel any pain or tenderness. No?
Feels good.
Feels good. Okay. Okay. I'm gonna go ahead and sit up. Okay. It's okay.
I'll have to look for it.
Okay, no problem. So I'm gonna go ahead and assess your back, your spine. So I'm gonna lift up your shirt.
Okay.
I'm just gonna check.
Sorry, my
No,
pants were
no,
falling
no,
down.
no, I don't apologize. That's fine. Okay, I'm just gonna lift up.
Yes.
And I'm just assessing for your the color, temperature. Right now you'd be cold.
Yes, it was cold.
Cold.
Definitely cold.
I'm also assessing your skin turgor for hydration. Any edema or swelling?
No.
No edema or swelling. Good. And then I'm gonna palpate your back. And is there any pain or tenderness there?
No.
No. Okay, good. And then I'm gonna do a range of motion. So just follow along. I'm gonna start with your neck, and you're gonna go side to side. Go ahead. Yeah. Any pain?
No pain.
Okay, and then down and up. Good. And then around. No pain.
No pain.
Good. And then down to your arms. You're gonna go ahead and open and close, side to side. No pain. Good. And then with your hips, you can just do it. Yeah. Any pain?
No pain.
No. And then around your foot.
No pain.
Okay. Good. So I'm gonna be inspecting throughout your body any redness, swelling, any deformities that you may have, and then I'm gonna palpate your axillary nose right here. Any tenderness? No. And then down to your epitrochlear. Any tenderness? No. Okay. And let's see. Let me check for your capillary refill. So your nails. Any problem with your nails?
No, none.
No. Okay. And then since I'm doing that, so we're gonna do this the sharp versus dull test again. And now this time around, I'm gonna do it all over your body.
Okay.
So you're just gonna guess if it's sharp or dull. So go ahead and close your eyes. Okay.
Soft.
Good.
Sharp.
Good.
Soft.
Good. And then down to your fingers.
Hard.
Okay. And then I will do your legs too, but. And then let me assess for your brachial pulse, and then I'll assess both of them, making sure that they're normal. Good. Strong, equal bounding. Good. And then there's also some on your knees and your foot, but I won't tell you to undress right now. And then while I have you, well, since you're sitting down, I'm going to assess your reflexes. What's the moving part? So we'll start off with your arm, with your hand. I'm going to place it right over there. You can relax, just relax. Okay, and then I'm going to put, did you feel that? Okay, ready? Okay, and then you also have one right over here. Okay, relax your hand.
think I am. I don't know.
I don't know.
Like I'm trying to.
Okay, and then same thing. Good. And then your triceps. Okay, relax. Good. That one,
That one hurt.
Okay, and then just your knees. How's your when you do your spinning class? Whoa.
Whoa, that's fine. It didn't hurt, but I was like, whoa.
And I would do it down to your knees as well. Yeah. Oh, okay. Oh, delayed. Okay. Yeah. So when you do your spinning class, do you have any pain or any?
No pain.
No pain.
Mm-mm.
Okay. Okay. Let me assess your walking as well. So go ahead and step off for me. So you're just gonna walk normal to the wall and then back. Good. Good. And then again, you're gonna face the wall and you're gonna walk on tandem. So like heel to toe, heel to toe. Good. Okay. And then you're gonna walk back. Okay. Walk into the wall. Go ahead and walk on your toes. Good. And then walk back with your heels. Good. Okay, I'm gonna face you, have you face the wall, and then I'm gonna have you close your eyes, and then you're gonna put your hands up, which, yeah. Okay, good. And then gait is steady, no shifting. Then put your hands, palms up. Good. Okay. So now you can put your palms back down. I'm gonna just slightly tap them down. Okay. Okay, good. And then arms went back up. Good. Normal. That's normal and healthy. You can go ahead and take a seat again. I think that is all I need from you. Let's see. Have you been having any memory?
No memory.
Issues?
Problems.
No memory or difficulty concentrating?
No.
No. Okay, good. And then you said no swelling. I don't see any swelling of the eyes. Your hearing's been normal. Okay, good. And any changes to your voice?
No.
Or
changes.
what about your period?
No changes.
No changes.
Same.
Okay. So let me go ahead and step outside. I'm just gonna go ahead and consult with my resources regarding the plan of action for you, and then I'll be right back.
Sounds good. Thank you.
Yeah, of course. Did you want me? Okay. I was gonna ask if you wanted to check on your
No,
kids
you're
real
fine.
quick.
It's fine.
And then you said that there was another card.
Yeah,
Oh, thank you.
it's hiding.
What's this say? Okay, so I'll be right back. Okay, it's still recording. Do you want me to stop it?
Oh, that's fine.
That's fine, okay. I'll be right back. I'll be right outside if you need anything, okay? good. So, another few things that I am concerned of. So the first thing is the hypertension, but that's been ongoing for you.
Yes.
But the blood pressure from your visit, it seems a little bit more elevated than normal. You've been ranging in the 140s over 80s, and normally it's 120s over 80s. Because of that, I would want you to start recording your blood pressure twice a day. And then for your weight, which you already know, you have increased BMI. So I'm going to refer you to a nutritionalist. I'm also going to be teaching you a few of the dietary things that we can do to work on with the weight gain.
Okay.
My main concern is the hypothyroidism, which could be causing the fatigue. Actually, a lot of your symptoms, your fatigue, your weight gain, your constipation.
Yes.
So because of that, I'm actually going to be recommending starting on levothyroxine.
Okay.
That's normally I'm going to just start you on a low dose. You take it every day before breakfast, 30 minutes before breakfast.
Okay.
And then we'll see how you do. So I'll ask you to come back in 1 month and see how the levothyroxine's been working on you. So basically the hypothyroidism, your hypothalamus releases TSH and produces thyroid hormones, and you're not effectively releasing, your body isn't effectively releasing enough of those hormones, and that's why there's the hypothyroidism.
Okay.
So the medicine, what it would do is it would compensate for that lack of hormones, and then basically increasing you. So we should see a little bit more increase in energy, and then balancing your weight as well as with the bowel movements. Okay. And then with that, since you're gonna be starting on the medication, I wanna check your baseline for your thyroxine levels. So T3, T4, and TSH.
Yes.
So we just have a baseline and we know what we're working with, and then we'll start you on the antibiotics. I mean the levothyroxine, and then I'm also going to be recommending increasing iodine intake, which helps regulate the hypothyroidism.
Okay.
Thank you
so much.
That's all. Do you have any questions for me?
I don't.
Okay. Thank you.